Okay, hi everyone. Thank you for joining me in your lunchtime today. And I think we have some people joining via the web video conferencing. So just those who are on the video conferencing, maybe just and make sure you're muted in case. I think we could hear one of you actually. Is that right? But thank you for joining. Okay, so today I was going to I wanted to give you an overview of what this project, the BC Health Research Connection Project, is about. We're a demonstration project of the BC Support Unit. And if you're not familiar with who the BC Support Unit is, it's one of 10 support units across Canada, and it's part of CIHR's strategy for patient-oriented research. So if you're not familiar with patient-oriented research, it's research that's done in partnership with patients and really identifying patient priorities versus just doing research on patients. So you're doing it together with patients. And so my name is Stephanie Chia. I'm the project manager for this project. Dr. Robert McMaster from BCHRI is our principal investigator. And we're based at Vancouver Coastal Health Research Institute. But as I mentioned, we are funded by the support unit, and this is a provincial project. So we are working with all the health authorities and academic research institutes and universities across BC in the development of this project, and the scope of this project is truly provincial. So this project stemmed from the need to really try to satisfy two different stakeholder groups. The first one is the patient or the public, so helping them to find a place to where they can find out where health research opportunities they can participate in. And then the second being researchers, such as yourselves. Where can you find study participants for your research study, or if you're looking for patient partners in order to conduct patient-oriented research. And what was interesting was there was a public opinion poll conducted not too long ago that really showed there was a very high interest from British Columbians about participating in research. In fact, 70% of people who were polled said they were interested in learning more about participating in health research, but only 15% were actually aware of opportunities to do so. So that's just a large gap that our project is really trying to close in order to help raise awareness about research opportunities amongst the British Columbians and help connect them to participate in research. So the objectives of this project really are, we want to build something that was truly accessible to patients, regardless of their location or where they might receive treatment. So we didn't want to build something that was only for Vancouver Coastal Health or geographically based. We also want to build something that was accessible to members of the public. So you don't necessarily need to be a patient and being seen at a health authority site. And that can help enroll people who are the healthy volunteers or controls. And we wanted to create a provincial recruitment strategy for researchers to find volunteers from across the province, as well as support patient-oriented research. So the project scope is supporting all types of health research, including Research Ethics Board approved research studies from various disciplines, but also the patient-oriented research where you're looking for patient partners. So with some initial environmental scanning and doing a lot of background research, we came up with this new proposal to create a provincial platform that will connect British Columbians to health research opportunities. And this provincial platform is really made up of three main components. So the first component will be building a central provincial website that will act as a resource in BC for people to go to find out about research opportunities. And then on that website, we'll be establishing and creating a research inventory. So this is an online listing of active research opportunities that are looking for volunteers. And then the third component of the platform is a patient or public research registry. So this is meant to capture any individuals who are coming to the site who are interested in research but may not want to come to the site every day to check our inventory, and they want to sign up and say, please notify me about research opportunities that I might be eligible for in the future, and we'll capture them in this registry piece. So I'm going to talk a little bit about each component now. The first one is the website, and we've looked at a few different models that have been doing the similar designs. One is the Pitt Plus Me website that's run out of University of Pittsburgh, and another one is researchmatch.org, which is a U.S. National site that's run out of Vanderbilt University. And both of them are very similar in that they're online web platforms trying to connect the public to research opportunities. So on the website, the research inventory that we'll be building, this is a screen cap from the PIP plus me site, but we'd like to build something similar where it'll be a searchable listing, and you can search by research category or eligibility or location, and just be giving you high-level information about different research opportunities that a member of the public might be interested in. So they could come to the site and just type in their filters and then see what's out there that's currently being offered. And then the third component is the registry. So in order to be contacted and notified about upcoming research opportunities, we'll be asking people to sign up and provide their contact information, a set of demographic information, and then asking them to select their health research categories of interest. So this is an example of what that might look like from PIP plus me. But as you can see, there's several high-level research categories, and if you clicked on one of these higher-tiered categories, it would unravel several subcategories. So this is the patient or a member of the public self-identifying. These are the types of health research I want to hear about. And essentially, they'll be creating a profile for themselves. And then based on that profile being created, we're basically matching them to research opportunities, similar to a dating site possibly, but they'll receive email notifications saying, hey, we have this new opportunity matched to your profile. They'll be able to read more about the specific research opportunities, some of the eligibility criteria of what it means to be a participant or a patient partner, and then they'll be able to choose whether they want to say, yes, I'm interested, and allow the researcher to then contact them about enrolling in that opportunity, or they can say, no, thank you, I'm too busy, or this is not applicable to me. So that's the general process of how we envision matching patients or public to our research opportunities that are in our inventory. So I wanted to just briefly touch upon our database or software concept, which we are partnering with Population Data BC. So they will be building this database piece, but we envision that public participants will come to our site through the web server. They'll be entering their information for the registry, and then that information gets sent to be stored in a secure database that will be held at Population Data BC behind a firewall, and an encryption will also be encrypted. Then the matching engine software will review the two databases and match them and send back information to researchers to contact these potential volunteers. So we see a number of benefits for the patients and the public. Mainly is that now we'll have a central resource that we can direct people to go to this website. This is where you can find out and connect to research opportunities. Because we built it as a web platform, it's accessible 24/7. They have flexibility on when they want to go to the website and search. It's not relying on a patient coming to a doctor's clinic visit and being approached by a doctor or researcher. So there's more flexibility in that sense. And now we're empowering the patients and the public to choose the types of health research they want to hear about versus the other approach where a doctor or a researcher will say, I know you have this condition, so I'm going to offer you this research opportunity. But patients will have multiple conditions and multiple interests, and that's what we really want to achieve by giving them the power to choose what they want to hear about. And so the benefits for the researchers with this provincial platform, you'll be able to recruit from a broader population across BC, since it's open to anyone in BC to join, including healthy volunteers or the controls that you might need for your study. You can use it to find both research participants for your ethics-approved research studies, but also if you're conducting patient-oriented research, you can use it to find patient partners to join your research team and help you identify the research priorities and shape your research design. You'll have the ability to promote or advertise your opportunity on this provincial research inventory, and we are hoping that with this web matching system and automatic emailing, that it'll be less administrative resources for researchers who do a lot of recruiting. So a more streamlined approach on a larger scale. So these past maybe 4 months, we did a lot of public engagement. So we held 5 consultations with various different populations across BC. We held 2 in Vancouver, One was a youth-targeted community dialogue. We held one in Victoria that was targeted with senior citizens or the elderly population. We also held one in Surrey with Fraser that was promoted to the Southeast Asian and Chinese population. And I recently went up to Prince George to meet with an Indigenous research community there about how this might impact the research for that group. So we had a lot of great feedback. We used these display boards that we asked people to provide notes on and stickers to choose like their top voted features. And we heard a lot of positive enforcement and validation for what we're building, which was great. We also heard that what they wanted to see on our finished platform was something that was very user-friendly, that is not confusing for some way to sign up. They also, a lot of individuals said they wanted flexibility on what information we want to collect. So that means a lot of individuals have varying levels of comfort on what information they want to share, even date of birth or postal code or some things about ethnicity. They want it to be optional. So we're looking at maybe not having all the fields being required, but also there was concern about keeping our information private and secure. So we are working with Population Data BC to ensure that. And also they said what would be great was to find additional methods to help those individuals who aren't computer or email users. So we're also looking at ways that we can have linked profiles where somebody can sign up but also be looking on behalf of somebody else. And then for the researcher side, we started with doing a lot of over 25 interviews with researchers across BC and from various faculties. And we held a webinar in the summer months where over 100 people attended. We also did a call for survey responses on the health research categories that people would need to select from, and really trying to help us narrow down a good set of research categories that researchers would be able to use, as well as patients and the public. And over 200 people responded, and these were the institutions that were represented. So we really are getting a lot of feedback from across the province in this project, and really hoping to build something that will work for everyone in the end. And what we heard from researchers was this is a tool that could be useful for finding healthy volunteers because it's open to the public. But they also want a simple and flexible way to use it with minimal barriers, so not having to jump through many hoops in order to sign up and send your post your research opportunity. Maybe also look at ways that it can be tablet or mobile friendly, so it could be used in person if they wanted to, if they had the resources and wanted to sign people up at their specific clinic or where they know their target patient population is. And in addition, we should be engaging community organizations in order to engage vulnerable populations who may not come to the site themselves and sign up to look for research opportunities, but go through the organizations that serve those populations. Look at promoting youth involvement and facilitating pediatric research. So that was one of the reasons why we held one of our public consultations with the youth, so with high school students, and we got a lot of great feedback from them. So the last thing was explore data linkages with other health data sets. Right now, how we've designed the platform is that we are connecting researchers to a person who's interested in that specific research opportunity, but it's all self-identified information that we're collecting from the patient or the public. So it'll be up to the researcher to do additional eligibility checks if they need to look at medical records or other criteria. But one of the reasons why we are working with Pop Data BC is hoping that in the future we might be able to streamline that process a little bit for the researchers, so that maybe we could do some linkages for them if allowed by the patient or the public user. So that's a future plan, hopefully, that we'll explore. These are just some of the universities and health authorities that we've been engaging throughout our whole planning process. As you can see, we have representations from all the different health authorities and they are represented on a project working group that has been meeting to help shape the design of this platform. But there are additional universities and other groups that we are hoping to engage with, and truly wanting this to be provincial and not just a VCH focused project. So with a timeline, so the last year or so has been the planning and really this engagement of stakeholders, both on the public and researcher side. And in the next few months, we will be starting our next phase of development and design. So we have both Population Data BC and a website company that will be helping us build this website platform. So the design and development will happen. And then hopefully in late spring, we'll have a prototype that can be tested with our users and then lead to refinements and final development. So then by late summer is when we're hoping to have a launch, so that it will involve education and training of the research groups that would be using it, and then our public marketing campaign to really let everyone know this is up and running and can be used. We're doing the, just going back, the user testing and final development, as well as this next 6 months with development. We're working with identified pilot sites. So these are research groups or research projects that will assist us with the development and testing of the platform registry. We put out a call for pilot sites, and then we got responses from people who were interested. So we chose sites that were across the province, but they will be involved with looking at our processes and the data that we're collecting and reviewing it and giving feedback on that. But when we do the prototype user testing, they'll also be testing out this site navigator role, where we would like to encourage people to sign up in person with the help of these pilot sites. And that would really help us increase enrollment into our registry and really test out all our procedures. So these pilot sites we're meeting our first meeting is next week. So, and then we envision their help with our final procedures over the next 6 months too. And then the next steps are, we have been engaging privacy departments, but we will continue that and work with the Office of Information and Privacy Commissioner to verify provinces and submit a privacy impact assessment. We have also been engaging with the research ethics boards across BC through the BC Ethics Harmonization Initiative, and just circling back to make sure that all our procedures are ethically sound. And then, as I mentioned, when we do our public launch in summer, we'll need to pair that with a marketing campaign and really develop what are the best strategies for enrolling people or letting people know about this website. So the last thing is this project being funded by the support unit. We have a limited project funding period, so we do need to explore how we will sustain the ongoing operations, and we have a few options that we're trying to pursue, but that's one of the next things that we'll need to do. So that's the end of the presentation. This is an acknowledgement to our principal investigator and our project team here, listed here, as well as a picture here of our working group members and the support unit and the regional centers who have also been supportive through our community dialogue and consultation events as well. So that's the end, and I'm happy to answer any questions you have. There's our website link for more information, and we also have project updates that are shared on this website link, so please visit that if you want to know what the history has been in the last 6 months or so. Thank you. Are there any questions? No? Okay. Hi, yes?
If there are questions, could you just hit that mic
So I was just wondering, so one of the common reasons why people aren't interested in joining our permission to contact registry is they often feel like they're going to be burdened with like an overwhelming number of like emails, calls, whatever it is. So how are you guys going to kind of balance that and manage it?
Yeah, so obviously when someone signs up in the registry and creating their profile, the more things they select, like health research categorized, is like the more opportunities that they'll be receiving. So if they only want to receive very specific about this one specific medical condition or disease, they can choose that only one category, versus if they choose multiple, they'll receive all of those types. Another question that we're going to ask in the profile setup form is, how often do you want to be notified? So we're looking at the options of like once a day, once a week, or twice a month, and like sharing those opportunities in like a bulletin or newsletter format, so they have multiple in one email. Is this a web platform that you think your research projects would use as a recruitment tool for finding either research participants or patient partners?
That we'll need to put through to our ethics board to say that we're using.
Yes, I believe so. Yeah, so that's one of the reasons why we have the ethics boards engaged in our in these planning processes, is really that they are aware of what this platform is as a recruitment tool, so that researcher, you can just say, I'm using the website to post and find research opportunities, and the research ethics boards already know like what we're doing.
So how will researchers enroll to be able to use this? They have to be associated with the health authority?
Right now, we are looking at probably universities, academic universities and health authorities, but we would like to open it up to outside of that academic research field. We just need to, it's just much easier to validate researchers we know in the academic field, but we eventually would like to see it open to all BC researchers. But I think we'll start with the process of how we approve and validate academic researchers, and then another process for how we might check that this person is suitable to use this site.
Hi, just a quick question about how long the data will be kept for each patient who registers in registry, if they're concerned about how long their information is going to be kept.
We haven't really thought about putting an expiry date on that information at this point, but maybe that's something that our privacy and ethics can inform us of, whether that we need to, have like an update reminder sent out, like you're in this registry. Do you need to update your information, or do you still want to be a part of this, have your information in there?
For patients that are registered and say they're sent an opportunity and they choose to take that opportunity and they're enrolled in a study, does it put their information on pause or on hold so that they're not being sent information about other studies? Because obviously patients can only really do one at a time.
I don't think it'll be, because we're not capturing the information of whether somebody has actively enrolled or is participating in a study. It would be up to that person to update their profile and say, maybe a pause, or I don't want to receive any notifications. But just because they're in one study doesn't automatically eliminate them from participating as a patient partner in something else. So it would really be up to the public account holder to update a profile and preferences. But yeah, I actually have heard that that suggestion before, of maybe like a pause notifications feature versus like not dropping out completely.
Respiratory, we just opened 10 studies. So if all of a sudden a patient qualifies, they said they don't want respiratory, they could get sent 10 studies, and they might qualify for a few of them. And if they go on one, or one starts a little bit after, it might add some confusion if now all of a sudden there's multiple options for patients.
Yeah, so I think it would be necessary to build some type of pausing feature, or they can specify, I've enrolled in a study, please pause my notifications for this time period. Sure. Are there any questions from the online participants through the web video conference? Okay, great. So I think if there's no more questions, I'm happy to talk to you offline if you had some more specific questions you wanted answered. But we are moving towards the development phase of this project now. So the next 6 months will be very busy actually building the infrastructure of the website and database piece. So look out for more updates on where we're at, and hopefully next year this could be something that's useful for you and your research needs. So, thank you.